Welcome back to the Deep Dive. Today, we're digging into a really interesting review from 2025. It's all about artificial intelligence and its growing footprint in healthcare administration.
Right.
And the source material basically asks this big question: is this AI push a genuine revolution for healthcare, or is it, maybe a risky disruption?
A very critical question.
Absolutely. So our mission today is to pull out the key insights for you. We'll look at the amazing opportunities, but also the pretty serious challenges that pop up when you start weaving AI into managing healthcare.
And there's a lot to unpack. What's really striking, I think, is just AI's raw potential to make healthcare administration, well, way more efficient. And cheaper, too.
How so? Like, give us an example.
Okay, think about the admin burden. AI can slash that. It automates really labor-intensive stuff, like digging through invoices in the finance
Oh,
department.
yeah, that sounds tedious.
It is. Or, automatically drafting standard leave notes for staff. Simple things, but they add up.
So it's really about freeing people up from that kind of drudgery, letting them focus on more complex things.
Exactly, but it's not just about efficiency. That's the key thing.
Right. It goes further.
It does. If you connect the dots, look at the bigger picture. AI can seriously boost patient outcomes, improve how decisions get made.
Okay, how does that work?
Well, it can analyze enormous amounts of messy, unstructured patient data. Not just the neat records, but notes, genomic data, social determinants of health.
Stuff that's hard for humans to process at scale.
Precisely, and it finds patterns, connections, things we might miss. This leads to better predictions like who's at risk for readmission or mortality. It helps guide screenings, diagnostics, make them sharper. It can even pull together data from different hospitals, giving us insights across whole populations that were, frankly, impossible before.
Wow. Okay, that's the potential side. Powerful stuff.
Yeah.
But, this report doesn't just paint a rosy picture. It raises some big red flags, too.
It certainly does.
This is where it gets really crucial, I think. With great power comes great responsibility, right? So what risks really stood out to you in the research?
Yeah, and that brings up the core challenge. How do you actually manage these risks? The paper really hammers home the concerns, especially around patient data privacy.
Always a big one in healthcare.
Huge, and the speed things are moving at, especially with these new, incredibly powerful, like super large language models and everything moving to the cloud, creates serious risks.
How so specifically?
Well, think about it. You can de-identify data, strip out names and obvious identifiers, but with enough computing power and, cross-referencing with other data sets.
You could potentially re-identify someone.
Exactly. You could link that anonymous health data back to a specific person. Imagine your health app data somehow getting linked to your supposedly anonymized hospital records. It's subtle, but the potential for harm is massive.
Yeah, it's genuinely concerning. Okay, so privacy is one big area. What else? Bias is often mentioned with AI. Does that show up here?
Oh, absolutely. It's another critical challenge. The data we train these AI models on, it can reflect old biases, historical prejudices baked into past medical decisions.
So the AI learns the bias.
It can, unfortunately. So you might end up with an algorithm that, say, consistently undertreats certain groups. The paper mentions Hispanic patients as one example where this could happen, maybe perpetuating existing health disparities.
And is it easy to spot that bias?
That's the problem. Sometimes you run into the black box issue, some complex AI systems.
Yeah.
Well, you can't easily tell how they reached a decision.
So you can't explain it.
Right, and if you can't explain it, how do you guarantee it's fair? How do you hold it accountable, especially when patient health is involved?
Yeah.
This lack of transparency. It can also lead to relying too much on systems we don't fully get. Makes it really hard to be sure they're safe and reliable.
And all this rapidly changing tech, what about regulation? Can the rules even keep up?
That's a major point the review makes. Often, policymakers, regulators, they just don't have the deep technical know-how to stay ahead of the curve or even keep pace.
So there's a gap.
A big one. It creates an imbalance, and that opens the door to unintended negative side effects for the whole healthcare system.
Okay, so if we put all this together, efficiency gains, better insights, but also privacy risks, bias, the black box, regulation gaps. What does this actually mean for the people working in healthcare? Are doctors and nurses going to be replaced by robots?
Well, some jobs might change, definitely. Repetitive, lower-skilled tasks. Yes, automation will likely take over many of those, but AI can't replicate the core human element.
Like empathy.
Exactly. Empathy, emotional intelligence, that human connection. That's irreplaceable. What this really signals is a need to upskill the workforce. People need to learn how to work with AI.
So collaboration, not replacement.
That's the ideal. And what's really key, fascinating actually, is the need for deep collaboration between fields. You need teams with both medical experts and tech experts working hand in glove.
Makes sense.
But the review points out there's often a profound lack of understanding between these groups right now. So building that bridge is critical for success.
Right. Okay, so wrapping up this deep dive, it really feels like AI in healthcare administration is, well, a classic double-edged sword.
Definitely.
Huge potential, for making things run better, improving care.
Yeah.
But matched by equally significant risks. Privacy, bias, how we govern it.
Yeah.
And the big takeaway seems to be, it's not just about the technology itself. It's really a human challenge, isn't it? How we adapt, how we collaborate ethically.
Couldn't agree more. Successful AI integration isn't just about buying the tech. It needs careful strategic design, ethical thinking right from the start, always putting patient well-being first.
So the question for you listening in is this. As AI keeps reshaping healthcare, what unique human skills do you believe will become the most vital, especially to make sure we use this powerful tool ethically and effectively given all these challenges we talked about? Something to think about until our next deep dive.